Hi, good evening. In this presentation, I will be presenting the head-to-toe assessment from the Sentinel-U case with the patient Mora Seremoko. I'm here with the patient and I will be interviewing the patient. Hi, good evening. How are you? My name is Linda and I'm going to be your nurse today. Please, can you tell me your first and last name and your date of birth?
My name is Mora Mukum, date of birth 10/5 1995.
Okay, thank you, Miss Mora. What brings you in today?
I'm tired and I don't want to do anything.
When did these symptoms started?
After 2 years of being with my husband, he said he wanted a divorce and that he had other girlfriends. He also said I'm not fun to be around with anymore because in the last year I don't want to do anything.
Does he still live at home?
No, he left 2 weeks ago. Since then I can't stop crying. I wake up crying, shaking and scared. I wake up, I feel like life is over for me. I wake up in the night crying and scared, and I feel hopeless.
Have you spoken to anyone about your feelings?
Yes, I went and saw a therapist and I was referred to a psychiatrist. He prescribed venlafaxine.
Are you still taking the medication?
No, because I feel good.
Have you ever attempted suicide or have homicidal thoughts, or do you have thoughts of hurting yourself or others?
No, I go to church every Sunday and it helps me. It helps me, and also I have a great family that supports me.
How are your feelings in the last few weeks?
I've been feeling sad and unmotivated. Don't want to do anything. I just want to lay in bed all day, wake up with anxiety in the middle of the night and loss of appetite. And I've also lost 10 pounds in the last few weeks.
What medical history do you have?
Hypertension.
Do you take any medication, both prescribed or over-the-counter medication?
Yes, I take lisinopril and hydrochlorothiazide.
Hydrochlorothiazide.
Yeah.
Do you have a family history of medical and psychiatric problems?
Yes, my mom had depression, my father had depression, and my sisters had depression.
Any history of abuse or trauma?
No.
Who do you live with?
Alone since my parents died.
Do you exercise or have any hobbies?
I used to walk around the block, but not anymore.
Do you smoke, use alcohol or any drugs?
No, I have never smoked or taken any drugs, but I drink wine.
How is your sleep and appetite?
I have poor sleep and loss of appetite. I've lost 10 pounds in the past few weeks.
Okay, Miss Mara, I'm going to do a physical assessment on you. Is it okay by you?
Yes.
Is it okay if I touch you?
Yes.
Okay. So I've assessed the patient and I took her vitals. So her blood pressure is 136/60, heart rate 67, pulse ox 99%, on room air and respiration 18. So are you having any pain right now?
No.
Okay. So I'm going to wash my hands. The first thing I'll wash my hands, then I will put on my gloves. So right now I'm gonna do it. Okay, can you move your chairs behind for me? Okay, I'm going to do a head to toe assessment. So I'm going to start from your head and now move down to your toe. Is that okay?
Yes.
Okay, so right now I'll look in my patient's hair. So her hair looks good, there's no thinning. And I'll move to her ears. So I'm gonna use this as my flashlight. So her ears looks good, there's no drainage. And I'll move to her eyes. So I'm gonna flash the light in your eye, but don't look at directly at it, okay? So please, can you follow my pen, the direction of my pen? Okay, my patient's pupil around are reactive. So right now I'm going to look at her nostrils. So her nostrils looks good, there's no bleeding. I'm going to look at her mouth, check her mouth, her lips. So her lips look soft and there's no discoloration. Right now I'm going to check her mouth. Can you see ah? My patient's teeth, they are all intact. So, and the oral and mucosa cavity are pink and moist. So I'm going to check for hydration by pinching my patient's neck. So her skin to go shows no tinting. I'm going to check my patient's skin. Can you stretch your hand for me? So my patient's skin, both upper bilateral extremities, they look dry, but there's no bruise, no discoloration, no swelling, no edema. Can you stretch your both feet for me? Now look at her lower bilateral extremities. The skin looks good. There's no breakage, no edema, and no swelling. So I'm going to listen to her lungs. So can you take a deep breath for me? So going to listen in the back. Okay. Her lungs sound so clear. No distress with breathing. I'm going to check her heart. Her heart rate and rhythms, they're regular. I'm going to check my patient's capillary refill. So I'm going to start with the bilateral upper extremities. I'm going to start with bilateral. So I'm going to pinch the tip of her fingers. So a capillary refill in both bilateral upper extremities in less than 2 seconds. And her capillary refill in the lower extremities are less than 3 seconds. Right now I'm going to inspect my patient's abdomen. Can you then? Okay. My patient's abdomen, so bowel sounds are present in all the quadrants. So I'm going to check her range of motion. Can you wiggle your hands for me? Can you put your hands like this? So I'm going to push, don't let me, okay? So my patients have full range of motions in the both upper extremities. Can you stretch your feet for me? So I'm going to push, don't let me, okay? Okay, my patient also have a full range of motion in both lower extremities. So I'm going to check my patient's pulse. So I'm going to check the radial pulse in both bilateral upper extremities. So her radial pulse in upper extremities, they are less than her radial pulse in upper extremities at +2. Then I'm going to check the dorsalis pedis in the bilateral lower extremities. So her pulse in the lower extremities, they are +3. Okay, can you stand up, move in front and come back for me? Come back and walk back. So as you can see, my patient has a full gait and balance. Okay. Thank you, Miss Mora, for your cooperation. I know I have asked you this question before, but please, can you tell me once more your first and last name and your date of birth?
My name is Mora Mukum. Date of birth 10/5/1995.
Okay. Do you know where you are right now?
Yes, in the hospital.
Okay. So you were diagnosed with major depressive disorder. Some labs were done. So major depressive disorder is a common mental health condition that is characterized by persistent feeling of sadness, hopelessness, and loss of interest or pleasure in activities. And you were prescribed medication, and the name of the medication is escitalopram. It is an antidepressive medication, and it is called a selective serotonin reuptake inhibitor, which is commonly used for major depressive disorder and generalized anxiety. This medication works by inhibiting the reuptake of serotonin in the synaptic cleft and then increase the ability to the brain. Do you have any question about the medication?
No.
Some side effects of the medication could be nausea, like feel like throwing up, fatigue, insomnia, you can't sleep, sweating, and then weight changes. And it takes 2 to 6 weeks to take full effect of this medication. And you were also referred to individual therapy to help with the depression. Do you have any question for me?
No.
Okay. Thank you so much, Miss Mora, for your cooperation. So this concludes the presentation for the physical head to toe assessment for Miss Mora Siremoko.